our webinar. I have a very special guest with me here today. He's a good friend of mine. We're going to call her Dr. Kris today. It's an easier one for you all. And Kris is just going to be talking about all things COVID. And this really came about because we often catch up and have a chat, and she was telling me all of these very interesting things about COVID, which I didn't know about. And I think, as an intensive care doctor on the front line with COVID throughout this whole pandemic, that, she sees and hears and knows things that most of us don't. So I just thought it would be really interesting. I've got a list of questions that I wanted to ask Kris and to go through. So I thought if any of you have any questions as we go about this topic, and I'd like to really try and keep it on this topic today if we can. If you've got any questions at all, I know some of you have actually been diagnosed with COVID either prior to starting the program or even during the program. So if you've got any questions related to that, then please start tapping away whenever you like. But until then, I'm just going to go through some of the questions that I've got, and we'll pick her brains a little bit. So I'm just thinking, why are some people hit so much harder than other people when they get COVID? What's the difference?
Sure. So there's a few different reasons. Firstly, it's got to do with the type of virus that you get hit with. So there are a few different subtypes of virus. The more famous ones that you know about are probably some of the more severe and the more transmissible. So viral factors. The other main factor is the host factor. So everyone is different. So firstly, people that are quite high risk of getting quite severe COVID are people who have other comorbidities like hypertension, obesity, high lipid levels, asthma and chronic lung disease, and high blood pressure. Also host immunity. So if your immune system is not quite established and strong, you'd be more at risk of developing a really severe response to COVID.
Does inflammation play a big role as well?
Definitely. So the way that COVID causes quite severe disease is it causes a massive inflammation response in the body. So your ability to manage that amount of inflammation, number one, is going to play a huge factor. But also people that have things like hypertension, obesity, diabetes have a baseline inflammatory state, if you like, and that impairs your immune system. So any baseline chronic inflammatory disease is also going to impair your ability to manage the virus once you get it.
Okay, so if you're starting with a certain amount of inflammation in your body, then obviously anything that's going to escalate that, it's going to be far greater than somebody who doesn't have that to start.
Absolutely, and that's why most of the hospitalised patients who are vaccinated end up having these other comorbid conditions, and that's why you see it more commonly in that subgroup.
That's really interesting.
Yeah.
So what are, and this might seem like a pretty simple question, but we're simple people. What are the most effective ways of reducing your risk of contracting COVID?
Sure. So I think if you think about COVID sort of like the flu, and if you're, the flu is very obvious when people have it. They don't look great, their nose is puffy and you look like you don't want to be around them. You don't want to get the flu and be at home for a week. So if you think about someone who has the flu, you would avoid them. You would want them to wear a mask. You would probably want to wear a mask as well with them. So I think definitely wearing a mask indoors really, really helps lower the transmission. I think keeping up to date with your boosters definitely will help your host immunity. Being healthy, having enough vitamin D, vitamin C, antioxidants on board. Just being sort of cautious about hand washing, making sure, your surfaces are clean and free of bugs. And just, as I said, keeping up to date with your vaccines. That's the best way to combat it. I think one of the main sort of reasons the UK and all those European countries were able to open and sort of live with COVID was they were being administered quite high amounts of the rapid antigen tests, and people could sort of take those tests before they caught up with each other in a closed environment like
Which
this.
we did, by the way.
Yes, that's right. Just to make sure, and so that everyone feels safe and, you know, can have a good time if they go out, and they don't have to worry that, you know. So rapid antigen tests do help, but at the moment they're in quite a low supply.
Yeah.
Yeah.
I live in an apartment building, and the amount of people who go to get in the lift with me without a mask on, in a small space and airborne, I
Without
believe,
any ventilation.
with nothing, is quite frightening, and don't really care.
Yeah. And it's just being aware of things like that. So, I mean, when someone comes into a small space lift with me, I will just get out and wait for the next lift.
Yeah, I do too.
Yeah.
Or they don't get in.
Yeah.
If I can close the doors quick enough. Can you get COVID more than once?
Absolutely, definitely. Just like you can get the flu more than once. There's different subtypes of virus. You can respond to it differently as well. It all depends what your immunity is doing, you know, that day, week, and what type of virus you get. You can absolutely get the virus more than once.
So the idea of having a COVID party and going out and catching the virus so that you can kind of put it behind you.
That's not a thing.
It's not
I'm sorry.
Sadly, it is a thing, but we wish it wasn't a thing.
No, exactly.
All right.
It's not a clever idea.
It's not a clever idea. All right, not at all. What sort of complications do you see in ICU? And I mean, we've kind of covered why, I guess, with that, but what sort of things do you see?
Yep. Well, intensive care is a sort of specialised area of medicine where when one or more of your vital organs are failing, you get admitted there for a high-level sort of monitoring, support of that organ. We usually have a machine to support that organ. So your brain, your kidney, your lungs, your heart. And the virus, sure, it enters through your respiratory tract usually, and the lung failure is quite, you know, well advertised, but the COVID enters your cells through a receptor that's present on most of your organs. So your kidneys have these receptors, your heart, your intestines, your brain. So it really depends on your immune response once the body processes the virus and which organs are more affected. You can get all sorts of really bad organ failures. So you know, if you get admitted to hospital, you have probably a 15% chance of ending up in intensive care on a ventilator because your lungs fail. Your heart could fail. You could get quite bad brain dysfunction and end up...
As a permanent thing?
Well, yeah, you could if you had quite bad sort of clots in the brain. And one of the things that COVID has shown us is it is very prone to clotting because it is such a pro-inflammatory disease. Inflammation causes clots throughout the vessels in the body. And I have seen people come in with COVID, not end up on a ventilator, but have a massive stroke and die.
Wow.
Yeah, it's quite scary.
I have a client of mine who had COVID, and she has a history of and she was actually blaming some clots that they found. She ended up in hospital with clots in her lungs, and she was blaming that on the vaccine when in fact it was actually the COVID virus that did it. And none of the medical specialists she'd been to see actually told her that it was actually COVID.
Right.
They just said, oh, we don't think it's the vaccine.
Yeah.
But no one could explain why. So that made her suspicious that potentially it was the vaccine because that's the only thing she felt she'd done different without realising it was actually caused by COVID itself.
No, when people come in with very severe respiratory failure to intensive care, we always scan their lungs for clots because so many of our COVID patients have overlying clot burden as well.
Wow.
Yeah.
Okay.
Yeah.
And what percentage of people that you treat in ICU are vaccinated? Do you think roughly? I don't need exact numbers, but...
I would say probably maybe 10 to 15% are vaccinated. As we saw more people get vaccinated, initially we only saw unvaccinated people in hospital and in intensive care. Once more of the population was vaccinated, we do get some vaccinated people in hospital, very rarely in intensive care. In intensive care, the vaccinated population probably has another underlying condition. You know, they might have cancer and they're immunosuppressed.
Yes.
So when they got the vaccine, they didn't really mount an immune response. They usually have another comorbidity, and by that I mean high blood pressure, obesity, diabetes, a lot of these long, chronic diseases that impair the immune response. It's these types of patients that are vaccinated and in intensive care.
Okay, that's interesting. I think we've probably talked through some of the symptoms and side effects of COVID. Is there anything else I think that we had there? We talked about the clots and how it can damage different organs.
Yeah, I mean,
I'm surprised about the brain. I didn't even realise that.
Yeah, we have some patients that come in with just really severe nausea and vomiting, diarrhoea.
Really?
Yeah, whereas the respiratory system doesn't seem to be that affected. It really depends on the host and how the virus decides what part of the body.
Which is why it's so hard to really diagnose probably before it's really full blown and they've probably been spreading it.
Yeah, that's what's so scary.
Yeah, exactly. I asked you that one. What are the highest risk factors we talked about? So do you think that diet and lifestyle can play an important role in, both sort of preventing the severity of when you get COVID and also helping you to recover once you contract it?
Absolutely. I was talking about this the other day, but if you think about, for example, we've just had the Australian Open. There's been really well publicised players who have had COVID pre-tournament.
Supposedly.
Yeah. And they've gone on to play in the Australian Open, and some of them have gone on to win the doubles men's Grand Slam.
Yeah.
So if you think about someone who is that fit, who has a really high lean mass, low body fat ratio, has a very good immune system, is able to combat the virus over a week or two, and has a good level of fitness underlying, eats well, and then is able to go and perform well. Their body is able to manage the virus a lot better than someone who, of the same age, who is probably more sedentary, has a higher body fat, doesn't eat as well, is not as active. Their immune system is probably not as good, and they will suffer more with the virus.
We've had a few people, start the program and then suggest that they maybe can't continue with it because they've contracted COVID. And, while I understand that, you may be in a confined space, so you're not going to be doing 10,000 steps a day, and nor would you probably feel like doing it if you're sick. But, eating the way of the program is only going to be a good thing to help to restore your gut health and to help reduce inflammation, which we've, been talking about is a really important part of this. The things that cause inflammation or exacerbate it from a food perspective are things like, sugars and refined carbohydrates, alcohol. All of those things are going to really increase inflammation in your body. So we're kind of doing the opposite to that in this program, and many people who even start with arthritis, for example, will notice within a week or two of doing the program, the joints don't hurt anywhere near as much as they normally do, and their mobility increases because of that reduction in inflammation. And also, I think visceral fat is pumping out inflammation all day long as well. So the more we reduce that visceral fat in and around our organs, the better your body is going to function and the better chance it would have of recovery as well.
Absolutely, it's so important. Making sure that you're eating foods that don't provoke that immune response, making sure your vitamin D and C levels are, well topped up, your iron levels, and just intermittent fasting has so many health benefits. It's been well published, and for all of those reasons that you just said. Yeah.
And with vitamin D, interestingly, obviously people are quite low at the moment, particularly if you live in Melbourne, because, we've been in lockdown and we've had face coverings, and most of us haven't been on holiday for a couple of years to anywhere sunny. So we're really not doing what we normally do to get sun on our skin. So there's a lot of people who are extremely low in vitamin D, but also being overweight in itself will cause you to have low vitamin D. So, if your levels have come up low in your blood test recently, and you haven't yet started taking a supplement, I think it's always a really good idea to just bolster your levels and your immune system. It's important. Can you take I'll talk on vitamin K2 benefits. Did you want to, or do you want me to? Oh, thanks. K2, look, K2 is one of those vitamins that's probably, there are many medications that you can't have it with, so anyone who's on warfarin or blood thinning medications obviously can't take that. And if you do take vitamin D, it often is paired up with K2 because they work together. So you just want to make sure that if you are on medications, just check what's in your vitamin D supplement before you start, or speak to your pharmacist about it. The ones we have in the online shop are just D for that reason, but please just make sure that you check that. Vitamin K and vitamin D are both fat-soluble vitamins that work together, and they can have, excuse me, a really positive impact on inflammation, your immune system, heart health, many things. You can also get vitamin K from green leafy veggies, which is why you take warfarin or drugs. They normally tell you to stay away from too many green leafy veggies for that reason, because it's high in vitamin K. It can help to thin your blood, which is the last thing you need when you're on blood thinners, but for most of us it's actually a positive. I'll actually put something in the next newsletter about K2 if you like, in a bit more detail, so that you've got some further information on it. Is there any other questions that you've got before we go? More about COVID and underactive thyroid in particular. Would that have any impact on it if your thyroid's underactive, do you think?
Well, I think the thyroid will influence your immune response. So you do want to make sure that you're keeping on top of your thyroid levels, getting your thyroxine intake in daily, making sure you're checking your levels every couple of months with your GP. It's very important for your immune response.
I find we have quite a few people who start the program who have Hashimoto's or an underactive thyroid, and a lot do ask me from a weight loss point of view if that will impact weight loss as well. But if you do have an underactive thyroid and that's been diagnosed, I would assume that you would be taking medication to correct it. So if you are taking medication to correct it, your thyroid levels should be normal. If you're on top of that, so it then I'm assuming shouldn't have an impact as long as you're medicated to the right level.
Correct.
Yep. Do you have any advice on how soon you should get a booster after having COVID?
That's a really good question. So having COVID will provoke an immune response and some antibodies, and that's what the vaccine does in your body as well. So at the moment, I think the guidelines are for your third booster shot is about 3 months. So if you think about a further dose, probably about 3 months after you've been diagnosed and recovered from it.
Yeah, that would make sense.
Yeah.
I've heard there's a tablet available if you contract COVID. Is this available to all patients? Do you know what that would be?
I'm not sure what tablet.
If you'd like to find out for me the name of it, or we can have a look. Yeah. We can put something on afterwards if you like and look into it. Tracy's asking about a couple of other supplements for prevention of COVID. I honestly don't think there's anything that's going to prevent it. I think that it's probably more a matter of looking at your overall system, reducing inflammation, and those supplements can help you to reduce inflammation as well. But I think rather than looking for something that's going to help you, there's so much out there on Google, I know, because it's such a big topic worldwide. But I think just be careful of things that are claiming to stop you or prevent you from getting COVID, because there is no such thing. If there was, we'd all be taking it and there wouldn't be any pandemic, I'm guessing.
Yeah, the best thing are those safety measures that I spoke about, just being sensible.
Sure.
Yeah.
And making sure that if and when you do contract it, that your immune system can cope with it the best it possibly can. I'm in New Zealand. It's over 4 months since my second shot. Initially, we were told to wait 6 months for the booster. Now we're being told 4 months, and we'll go to 3 months at the end of Feb. Should I wait?
Should you wait to receive the booster? I would just take the government advice, and if they're saying 3 months, then go at 3 months. Just get it when they're giving it to you as soon as possible.
Yeah, and you probably won't be eligible to have a booster until the government allow you to have one as well. So you'll have to comply with that. It is getting shorter, I think. For most, it's down to 3 months here. Yeah. The Victorian government just put out advice advising that the get the booster 2 weeks. Oh goodness, now I've lost it. 1 second. 2 weeks after getting COVID. Okay.
That does sound a bit soon. I haven't read that. But,
you think your antibodies would be very high, which is the same as when you've had a vaccine. So
I'd have to look that up on the government website. But you just go along with what the government has recommended.
Yeah, we can come back to you on those ones as well if you want to. Is there any other questions at all? It's a really interesting topic because, like I said, there's so much out there, you know, if you're Googling things, which we all do, and we only really hear what the government and the media tell us. So I just thought it would be really interesting to chat to somebody who is actually on the front line and dealing with COVID every day. I'm travelling to Europe late May. I had my booster early January. Will I still have immunity?
You should have some level of immunity, but if you can get a further booster before you travel, I would definitely do that. Yeah.
And again, you know, there's probably advice on that, even, you know, from the government as well, just on, there may be requirements of the country that you're going to, that you've had a booster within a certain period of time as well. So as every country is a little bit different and it's ever changing, it might even be worth just speaking to an embassy at the other end, just to make sure that you don't get there and find out that you don't meet the requirements of that country as well. I think that's something I'd probably be a bit concerned about.
Because it's so new, information is changing all the time. The latest guidelines have been updated on a daily basis. They're basically a live document. So you just have to look up these things closer to the time and make sure that you're complying with all the regulations. Yeah,
absolutely. Okay. What else have we got? Any other questions at all? If there's anything that we haven't covered off today, I'll come back to you a little bit later on the forums and just let you know some information. Can you tell me the latest close contact and isolation rules? I don't know that they've really changed, have they?
No.
I mean, I don't think they've changed. And again, it's as Kris said, it's really the government advice that we have to follow on all those things. It's possibly also different in every state, and I know everybody here is in different states all over the place, and some in New Zealand. So rather than us tell you something that doesn't comply with your state and your location, usually the government website in your state is the one that's going to update you on that side of things. It's not really our expertise. I believe the tablet, okay, I'm not familiar with that, are you, Kris? The tablet name? We can look that up though. Can you stand on the idea that a drench for livestock can help in any way? For COVID? Sorry, I'm not sure I understand the question on that one. I'm not sure Kris would get too much livestock through ICU. I'm not sure. I don't know.
No.
Oh, okay. I see what you're saying, Dimity. Okay, so apparently that is the same drug that we were asking about earlier. That's going to help to prevent COVID, which is commonly used as a drench for livestock. Now I get you. Now I get you. So apparently it's a drench for livestock that they're saying will help to prevent COVID, or when you get it, you take it. If it's not a medical advisory from you know, AMA or wherever it's coming from, I would say it's something that somebody has created that is going to give us hope for something that's possibly not there. And you know, when there's a desperate situation like there is in a pandemic, everyone's clutching at straws, and there's so many people taking advantage of your vulnerability because everybody wants it to be over. But you know, I was talking to Kris a few weeks ago and said, how do you think this is going to pan out in the long term? Like, you know, everybody's sort of thinking, oh, after this wave, it's gone. And I hear that a lot. And I think you said, like, most pandemics are at least 5 years, Yeah, at least.
Yeah, I think we're still going to be on a sort of bumpy road for the next sort of 2 to 5 years. At the moment, it's really still at a pandemic level all around the world. And that means that the disease is highly transmissible. it causes a lot of illness that the hospital systems are not able to cope with. Once it becomes more endemic and we have a bit more control and we have a bit more immunity, so either through vaccine and people becoming infected with it, the virus won't be able to have such an upper hand. At the moment, the virus has the upper hand, and that's why we need to modify how we live, unfortunately, and as annoying as it is, so that we can get through this up until we have the upper hand on the virus.
So this is where I think the myth comes in, and this is the information that I think that people need to hear, because, you know, thinking that going out and getting COVID on purpose is going to end everything for you, it's just not going to happen.
No.
You can get it more than once. Thinking that after this wave is over and the numbers of rates start going down in each state, that we're done, we're not. So I think, you know, even just for our mental health, it's really important to understand that this is going to take a long time and that we all have to live differently to be able to keep going. And I think that's the thing that's missing in the information, is everybody seems to be in the now, but not really understanding that you know, people are saying, I'm going overseas in July thinking it's done.
Yeah.
And it's not.
I think that's one of the biggest problems, and something that's really not coming out to the public from a government level, unfortunately, is that this is how we have to live now for the foreseeable future, and we have to adapt and we have to change. And as I said, it is very annoying. No one wants to wear masks all the time. They're uncomfortable. And all of that kind of stuff, you know, being worried about getting boosters, when is the booster, you know, can I go overseas, all of that kind of stuff. It is very stressful, but it is just the way that we are living now, because we have to learn to live alongside this virus until it becomes a less severe strain.
Yeah. And if we're worried about wearing a mask, you can only imagine what medical people need to wear in hospital. It's crazy. So do you see future boosters being a requirement as new strains are discovered?
I think that's probably very likely. I know that all of us in the medical profession have been getting vaccinated early, and you know, we're probably due for soon our 4th booster, and I know that everyone is very keen to get them because everyone wants to be protected facing this every day. Oh, pleasure. Good. I'm glad it was a bit helpful. I think it was just nice to sort of chat through it and get a bit of an idea. I've got a frog in my throat. I've been talking too much today. I just have not stopped. Too many consultations in a row. Thank you so much, guys. Some great questions there. So any that we didn't get to or that we were going to look up, I'll come back to you on the forums a little bit later. But a huge thank you to Dr. Kris for helping us. It was fantastic, and always so nice to get some proper, sensible knowledge from somebody who actually knows. Okay, thanks, guys. Speak soon. Bye.